Picture this scene from a Boston teaching hospital in 2019. Dr. Michael Patterson, chief of geriatric medicine, sat in his office surrounded by towers of medical files. He'd just completed the largest patient outcome review in his career, 50,000 medical records spanning 15 years, all patients over 70. What he discovered kept him awake for 3 nights straight. The data revealed a disturbing pattern. Seniors who underwent certain routine tests actually had worse health outcomes 5 years later than those who skipped them entirely. Not because the tests themselves were flawed, but because they triggered cascades of follow-up procedures, medications, and complications that the original test was supposed to prevent. One specific screening test led to serious complications in 68% of patients within 2 years. Another common scan increased mortality risk by 23% in the following decade, not from disease, but from the radiation exposure and subsequent procedures it triggered. Dr. Patterson presented his findings at the American Geriatric Society conference, expecting resistance. Instead, 17 other research teams stood up. They'd found the same patterns in their own institutions, but feared speaking out against standard medical protocol. Today, I'm revealing the 5 tests Dr. Patterson identified, why they're still routinely ordered despite the evidence, and the specific questions you need to ask your doctor before agreeing to any screening after 70. This information could save you from years of unnecessary treatment and complications that you were trying to avoid in the first place. Test number 5. Routine annual chest X-rays in asymptomatic seniors. Many primary care doctors still order yearly chest X-rays as part of comprehensive checkups, especially for patients who smoked decades ago or have mild respiratory symptoms. The logic seems sound. Catch lung problems early. But Dr. Patterson's data revealed something troubling. Seniors getting annual chest X-rays had a 34% higher rate of invasive follow-up procedures compared to those screened only when symptoms appeared. Here's what happens. The X-ray finds a tiny nodule, maybe 3 millimeters wide. Most are benign calcifications or old scar tissue from childhood infections. But once documented, medical liability requires follow-up. You're sent for a CT scan, which uses exponentially more radiation. If the nodule hasn't changed after 6 months, you're considered low risk. But if it's grown even slightly, you're referred to a pulmonologist. Suddenly you're facing a needle biopsy, which carries a 15 to 25% risk of lung collapse called pneumothorax. A 2020 study in Chest Medicine Journal followed 3,400 seniors who underwent annual chest X-rays versus symptom-based imaging. The annual screening group had 12 times more biopsies performed, but identical lung cancer mortality rates after 10 years. The only difference, the screening group experienced significantly more procedure-related complications, including collapsed lungs, hospital admissions, and anxiety disorder from false alarms. Unless you're experiencing new symptoms like persistent cough, unexplained weight loss, or coughing up blood, routine chest X-rays after 70 create more problems than they solve. Test number 4. Routine PSA screening for prostate cancer in men over 75. This blood test measures prostate-specific antigen levels, and elevated numbers suggest possible prostate cancer. Sounds like essential prevention, right? But the United States Preventive Services Task Force explicitly recommends against routine PSA screening in men over 70, and here's why. Dr. Patterson's data showed that men who continued annual PSA tests after 75 were 3 times more likely to undergo prostate biopsies and 40% more likely to receive prostate cancer treatment, yet had identical mortality rates compared to unscreened peers over a 15-year period. The problem is biological. Most prostate cancers in seniors are extremely slow-growing. They take 15 to 20 years to become life-threatening, meaning a 75-year-old man with early prostate cancer will almost certainly die from something else first. But positive PSA results trigger biopsies. Biopsies cause infections in 2 to 4% of cases and serious bleeding in 1%. If cancer is found, even slow-growing types, patients face tremendous pressure to treat it. Treatment options, surgery, radiation, hormone therapy, all carry significant side effects including incontinence, impotence, and bowel problems. A landmark study published in the New England Journal of Medicine followed 76,000 men for 20 years. Those screened regularly had no survival advantage, but had substantially higher rates of treatment-related complications. If you're over 75 and feeling healthy, having a thoughtful conversation with your doctor about stopping PSA screening might be one of the smartest decisions you make. Test number 3. Overly aggressive diabetes monitoring with tight A1C targets in seniors with multiple health conditions. A1C tests measure average blood sugar over 3 months, and for decades, doctors push for A1C levels below 7.0 in all diabetics regardless of age. But Dr. Patterson's research revealed a shocking finding. Seniors over 75 with A1C levels aggressively managed below 6.5 had 31% higher mortality rates than those maintained between 7.0 and 8.0. The reason is hypoglycemia, dangerously low blood sugar. Older adults have diminished warning symptoms for low blood sugar. They might not feel shaky or sweaty before losing consciousness. When doctors prescribe multiple medications to force blood sugar down, seniors experience more falls, more emergency room visits, and more cognitive impairment from repeated hypoglycemic episodes. A study in JAMA Internal Medicine tracked 2,000 diabetic seniors for 8 years. Those with A1C targets below 6.5 spent an average of 43 more days in hospitals over that period compared to those with relaxed targets of 7.5 to 8.5. They also suffered twice as many severe hypoglycemic events requiring emergency treatment. The American Diabetes Association now recommends individualized A1C targets based on life expectancy and overall health. For seniors over 75 with other chronic conditions, an A1C between 7.5 and 8.5 is often safer than the traditional target below 7. Having your doctor test A1C is fine, but insisting on overly aggressive targets and medication intensification to reach those targets can actually shorten your life rather than extend it. Test number 2. Routine carotid artery ultrasound screening in asymptomatic seniors. This is the test Dr. Patterson flagged as having a 68% complication rate. Carotid ultrasounds examine the arteries in your neck that supply blood to your brain, looking for blockages that might cause stroke. Many doctors order this test if you have risk factors like high blood pressure or past smoking history, even without symptoms. But here's the devastating finding from Dr. Patterson's data. When blockages are found, even moderate ones, patients are frequently pushed toward carotid endarterectomy, a surgery that scrapes plaque from inside the artery. This surgery carries a 3 to 5% risk of causing the very stroke it's meant to prevent, plus risks of heart attack, nerve damage, and death. The massive CREST trial published in the New England Journal of Medicine followed 2,500 patients with carotid blockages. Those who had preventive surgery had no better stroke outcomes over 10 years compared to those treated with medication alone, but had significantly higher complication rates from the surgery itself. Here's what makes it worse. Most people with carotid blockages never have strokes. A 2018 study found that 78% of seniors with moderate carotid stenosis who were treated medically with blood thinners and cholesterol medication never experienced stroke over 15 years. Yet when those same blockages are discovered through screening, surgical intervention rates exceed 60% within 2 years of diagnosis. Unless you've had warning symptoms like temporary vision loss or weakness on one side of your body, screening for carotid disease often leads to surgery that causes more harm than the natural course of the condition. Test number 1. Whole-body PET scans marketed as cancer screening. This is the most dangerous test Dr. Patterson identified. PET scans use radioactive glucose that lights up potential tumors throughout your body. Sounds perfect for early detection, but Dr. Patterson's data tells a different story. Seniors who underwent whole-body PET scans without symptoms had a 47% chance of false positive findings requiring invasive follow-up. The radiation exposure equals approximately 500 chest X-rays, increasing lifetime cancer risk by 1 in 200. A study from Memorial Sloan Kettering tracked 890 seniors who received preventive PET scans. Within 3 years, 34% underwent at least one invasive procedure for ultimately benign findings. The complication rate from those procedures, infections, bleeding, organ damage, exceeded actual cancers found and successfully treated. One suspicious node triggers biopsies, more scans, sometimes exploratory surgery. Each carries significant risk for seniors with limited life expectancy. No major medical organization recommends whole-body PET scans for screening in asymptomatic individuals. The American College of Radiology explicitly warns against them, stating potential harms substantially outweigh any theoretical benefits, particularly in seniors statistically likely to die from other causes before any detected abnormality becomes life-threatening. If you're feeling well with no concerning symptoms, spending thousands on a whole-body PET scan is far more likely to harm you than help you. If these 5 tests should be avoided after 70, what should you do instead? Dr. Patterson's research pointed to symptom-directed care rather than screening-directed care. This means responding to actual body changes rather than searching for problems that may never cause symptoms. The SMART approach has 4 components. First, know your baseline. Monitor energy levels, breathing, digestion, sleep, and cognitive function. When something changes persistently, that warrants testing. New cough lasting 3 weeks. Get a chest X-ray. Unexplained weight loss. Investigate. But scanning hoping to find something creates more problems than it solves. Second, focus on modifiable factors. Blood pressure control, healthy weight, physical activity, and stress management impact longevity more than screening. Studies show seniors who walk 30 minutes daily live longer than those undergoing extensive annual screenings while remaining sedentary. Third, communicate goals clearly with your doctor. If you prioritize quality over quantity, if you prefer avoiding aggressive interventions, state it explicitly. Many doctors default to maximum testing unless patients request otherwise. Fourth, question every test with 3 questions. What will you do differently based on results? What are the risks of the test and follow-ups? What happens if I decline? If your doctor can't provide compelling answers, the test probably isn't necessary. Dr. Patterson concluded his research with a revolutionary statement. For patients over 70, our goal should not be finding every abnormality. Our goal should be preserving function, independence, and quality of life. His hospital implemented new protocols requiring doctors to document specific justification for each test ordered. Routine screening in asymptomatic seniors over 75 dropped 64%, yet patient outcomes improved. Hospital admissions for test-related complications decreased 41%. Most importantly, 5-year mortality rates remained unchanged, proving less testing didn't harm patients. It helped them avoid iatrogenic injuries caused by medical care itself. The medical system profits from testing. Every scan generates revenue. Every finding creates billable follow-ups. You must advocate for yourself. Before agreeing to any test, especially these 5, demand clear justification. If your doctor seems defensive when questioned, that's a red flag. The test may be routine protocol rather than medically necessary. Use this phrase: unless I'm having symptoms, I prefer avoiding tests that might lead to treatments I don't need. That sentence can save you years of unnecessary procedures. Your body has carried you 70+ years. Trust it, listen to it, respond when it signals problems, but don't search for trouble that isn't there. Now tell us, have you ever questioned a test your doctor recommended? Share your experience below.